1. 17 medicines you must flush. CDSCO's Urgent Warning and Safe Disposal Guide. 2. CDSCO Warning. 17 high-risk expired drugs to flush immediately. Essential safety tips. 3. CDSCO's Flush List. 17 drugs you must dispose immediately. Expired medicine safety. 4. Expired Valium danger. CDSCO urges flush these 17 deadly drugs now. 5. 17 dangerous drugs you should flush down the toilet. 1. 17 medicines you must flush. CDSCO's Urgent Warning and Safe Disposal Guide. Imagine tossing your old medicines into the trash can, believing you've acted responsibly, only to discover you might be putting lives and the environment at risk. That's precisely the alarming issue the Central Drugs Standard Control Organization, CDSCO, India's leading drug regulatory authority, is addressing with its brand new public advisory. But here's where it gets controversial. For the first time ever, the CDSCO is specifically urging all citizens to flush 17 certain expired or unused medicines down the toilet, rather than discarding them with regular household waste or dustbins. This directive is a bold move in the battle against both drug misuse and environmental contamination, responding to widespread concerns about what happens to potent prescription drugs once they're no longer needed. If you're like many people, you likely have a medicine cabinet stocked with emergency pills, sometimes forgotten until the expiry date is long past. Most folks toss these pills in the bin, rarely considering the dangerous impact. According to a detailed Times of India report, the CDSCO has now made it clear, 17 specific high-risk drugs, including powerful opioids and psychotropic medications such as fentanyl, tramadol, morphine sulfate, buprenorphine, methylphenidate, tapentadol, oxycodone, and diazepam, must not be thrown away casually. What makes these medicines so dangerous? According to a CDSCO spokesperson, these substances are not only habit-forming and susceptible to abuse, but even accidental ingestion can be fatal. The risk is so severe that the only recommended way to dispose of them safely is by flushing, sending them directly into the sanitation system where they can no longer threaten strangers or curious children rooting through the trash. And this is the part most people miss. This urgent directive specifically applies only to the 17 listed substances, most of which are tightly controlled due to their addictive nature. The CDSCO is equally adamant that ordinary over-the-counter or non-addictive medicines should never be flushed, as even small quantities can wreak havoc on aquatic life and water sources. What should you do with those common non-addictive medications? The advice is clear: participate in a drug take-back program, which allows you to hand over expired or unused medicines to authorized pharmacists or relevant state departments for professional, eco-friendly disposal. If your locality doesn't offer such a program, always ask your pharmacist for guidance. This initiative gained momentum after a major study by the Ocular Pharmacology Division at AIMS, which revealed disturbing levels of pharmaceutical residues, including antibiotics and other drugs, in the Yamuna River and at the Gazipa landfill. These contaminants, mainly from improper household disposal, not only jeopardize fish and plant life but have also contributed to a surge in multi-drug-resistant bacteria. This hidden public health risk could pose far greater threats in the future if ignored. Environmentalists and drug safety advocates have praised the CDSCO's move, calling it a long overdue response to a problem that's often underestimated in discussions about urban health and sanitation. A senior environmental expert put it bluntly: expired medicines are essentially hazardous chemical waste. They seep into the ground, contaminate our water, and eventually come back to haunt us, both in our food and our drinking supply. This expert further stressed that robust public education campaigns and stricter disposal regulations are urgently needed. The CDSCO's guidelines are likely just the beginning. They're expected to pave the way for a national policy on pharmaceutical waste that could include strict penalties for improper disposal, nationwide drug take-back schemes, and comprehensive educational efforts targeting households and healthcare providers alike. But here's a provocative question: should all addictive or dangerous medicines be mandated for flushing, or do we risk trading one environmental problem for another by sending these substances into the sewage system? And what about people who disagree with flushing due to concerns about water pollution or sanitation infrastructure? Have you ever tossed medicines in the trash, or does your community offer a take-back program? Where do you stand on the debate between public safety and environmental risks? Drop your thoughts and disagreements in the comments. We want to hear your perspective, especially if you have a different solution in mind. 2. CDSCO warning: 17 high-risk expired drugs to flush immediately. Essential safety tips. Imagine having household medications so dangerous that regulators insist you flush them away immediately. That's the startling reality behind India's new drug disposal guidelines targeting 17 high-risk pharmaceuticals. The Central Drugs Standard Control Organization, CDSCO, has mandated that specific expired or unused medications must be disposed of via toilet flushing rather than regular trash. This critical measure directly prevents accidental ingestion by children, pets, or vulnerable individuals in homes, instances where even a single dose could prove fatal. The targeted drugs include extremely potent substances like fentanyl, oxycodone, tramadol, tapentadol, and diazepam. But here's where it gets controversial. While flushing prevents immediate household dangers, many wonder whether this contradicts environmental best practices. The CDSCO defends this exception solely for these 17 substances, emphasizing that their extreme risk justifies the method. These pharmaceuticals primarily treat severe pain, anxiety, and similar conditions, making their misuse exceptionally hazardous. The guidance document underscores that safe disposal isn't optional, it's essential for environmental protection and public health. Improper disposal can have devastating ripple effects: contamination of water sources, medicines scavenged from landfills by children, or even black market redistribution of expired drugs. Here's the part most people miss: expired medications aren't just ineffective, some can develop unpredictable adverse reactions. While most degrade in potency, certain categories become active health threats over time. The CDSCO's solution? A collaborative drug take-back initiative where pharmacies and state agencies establish dedicated drop-off points. This program aims to balance safety with environmental responsibility under the Drugs and Cosmetics Act. But let's confront the tension. Is directing citizens to flush pharmaceuticals an acceptable trade-off when lives are at stake? Should environmental concerns override immediate human safety in these exceptional cases? What's your view? Does this guidance strike the right balance, or create new risks? Share your perspective below. 3. CDSCO's flush list: 17 drugs you must dispose immediately. Expired medicine safety. ***, have you ever wondered what to do with those old medications cluttering your cabinet? ***, the Central Drugs Standard Control Organization, CDSCO, India's leading drug regulatory authority, has made a significant announcement that could change how we handle unused or expired medications at home. They have identified a list of 17 specific drugs that should be disposed of by flushing them down the sink or toilet. This list includes potent substances like fentanyl and tramadol, both of which are painkillers, as well as diazepam, a commonly prescribed anti-anxiety medication. The CDSCO warns that these drugs can be extremely dangerous, and even a single dose can be fatal if ingested by someone other than the intended patient. Therefore, if you find yourself with any of these medications that are no longer needed, the safest course of action is to flush them to protect both people and pets from potential harm. But what about the rest of your medications? For the majority of other commonly used drugs, the CDSCO has issued guidelines that emphasize the importance of proper disposal methods to avoid environmental contamination. They advocate for a drug take-back initiative, which could be spearheaded by local chemists or state drug control departments. Ultimately, the CDSCO envisions that state governments, in collaboration with local organizations, will develop a systematic approach for collecting and disposing of unused or expired medications in accordance with the biomedical waste management rules. The proposed drug take-back program would allow individuals to drop off their expired or unused medications at designated locations. These collected drugs would then be disposed of responsibly by the participating associations, with oversight from the relevant state drug licensing authorities and assistance from licensed external agencies. This initiative comes in response to numerous studies highlighting the environmental risks associated with improper disposal of medications. For instance, a study led by Dr. T. Velpandian from the All India Institute of Medical Sciences, AIMS, examined water samples from various locations along the Yamuna River and found traces of antibiotics and other pharmaceuticals in the water. This contamination is a direct result of medications being discarded improperly, contributing to the rise of multi-drug-resistant pathogens. Devarati Majumdar, the director and chief of pharmacy at Max Healthcare, praised the government's initiative to create guidelines for the disposal of unused or expired drugs. She mentioned plans to distribute pamphlets to patients upon discharge from hospitals, educating them on safe disposal practices. Majumdar pointed out that the drugs listed by the CDSCO for flushing are primarily narcotics, which are prone to misuse and addiction, underscoring the importance of their safe disposal. But here's where it gets controversial. Are we doing enough to address the environmental impact of our medication disposal practices? As we move forward, it's crucial to consider how we can all contribute to a safer and cleaner environment. What are your thoughts on the government's approach? Do you believe more should be done to educate the public on this issue? Share your opinions in the comment. 4. Expired Valium danger. CDSCO urges flush these 17 deadly drugs now. Do you have expired Valium lying around your home? That seemingly harmless strip of pills in your medicine cabinet could pose a serious risk. The Central Drugs Standard Control Organisation, CDSCO, India's leading drug regulatory authority, has issued a stark warning. Expired medications can be lethal if ingested by individuals for whom they were not prescribed. This is not merely a health advisory, it is a critical call to action that everyone should heed. Diazepam, commonly known for its use in treating anxiety and seizures, is particularly concerning when it has expired. In a recent guideline, the CDSCO has identified 17 specific medications that should be immediately disposed of by flushing them down the sink or toilet if they are expired, unused, or unwanted. This list includes potent drugs such as fentanyl, tramadol, and diazepam, all of which can have fatal consequences if they fall into the wrong hands. Dr. Dharaj Menon, a pharmacologist and professor at a medical college in Mumbai, emphasizes the danger. The drugs on this list can be deadly even in a single dose if misused or accidentally ingested by children, pets, or individuals with weakened immune systems. He likens keeping these medications in your home to leaving a loaded gun on the coffee table. The dangers of expired diazepam. Among the medications listed, diazepam stands out as particularly hazardous when expired or unused. As a benzodiazepine, it does not break down completely after its expiration date. This means that even years later, expired diazepam can still retain much of its sedative effects, making it a hidden danger. Dr. Riya Sadana, a brain surgeon from Bengaluru, dispels the common myth that expired drugs simply lose their effectiveness. That's not true for all medications, she explains. Even slightly degraded diazepam can significantly slow brain activity, potentially leading to unconsciousness, respiratory failure, or even death if misused. The side effects of this anti-anxiety medication include reduced breathing and heart rate. Experts warn that if accidentally ingested by children, pets, or anyone unfamiliar with the drug, the consequences can be dire. Dr. Sadana notes, a tiny dose or even a single expired tablet found in a trash bin could trigger a medical emergency. Dr. Vikas Goyal, a pediatric emergency consultant in Delhi, adds that there have been numerous cases worldwide where toddlers have ingested just one old tablet and ended up in a coma. Research has shown that expired diazepam can still produce calming and euphoric effects, making it a potential target for recreational misuse, especially among teenagers or individuals battling substance abuse. The uneven degradation of expired diazepam increases the risk of overdose, particularly when combined with alcohol or other sedatives. Moreover, diazepam can break down into unknown or unstable compounds, which may lead to unexpected side effects or dangerous interactions with other medications, especially antidepressants or sleep aids. Dr. Goyal warns that the effects of chemically altered expired benzodiazepines are not fully understood. Why flushing is necessary. While environmentalists typically advise against flushing medications due to the potential harm to ecosystems and the risk of contributing to antibiotic resistance, the CDSCO makes an exception for these 17 high-risk drugs. The immediate threat they pose at home justifies this action. Dr. Menon states, for this specific list, flushing is the safest immediate option. The public needs to understand that these are not just expired drugs, they are potential poisons. For all other medications not included in the flush list, the CDSCO recommends a more environmentally friendly disposal method. This recommendation comes in light of growing concerns about pharmaceutical pollution in India's rivers and soil. In 2018, alarming levels of drug residues, including antibiotics and psychiatric medications, were detected in the Yamuna River and Delhi's bore wells. This suggests that people are improperly disposing of old medications, contaminating the water supply and contributing to antibiotic-resistant bacteria. To combat this issue, the CDSCO has proposed a state-level drug take-back program in collaboration with local chemist associations and waste management services. ## What you should do right now. If you have any expired or unused diazepam, fentanyl, tramadol, or any other medications listed by the CDSCO, it is crucial to dispose of them immediately. ***, here's how to properly flush medications ***. Place the expired tablet or capsule directly into the toilet, do not crush it. Flush the toilet right away. Wash your hands thoroughly after completing the disposal. ***, for medications not on the flush list ***. Do not flush these drugs. Store expired pills in a sealed container. When possible, take them to an approved drug take-back site. This is a vital step in ensuring the safety of your household and the environment. Don't wait, take action today. 5. 17 dangerous drugs you should flush down the toilet. Are you unknowingly putting your family and pets at risk when disposing of old medications? Here's the wake-up call. ***, expired drugs require careful handling ***, and India's drug regulator has just revealed a critical exception to the usual disposal rules. Let's break down the surprising guidance that could prevent accidental overdoses, environmental harm, and dangerous misuse. This isn't just about proper recycling, it's about life or death. The Central Drugs Standard Control Organization, CDSCO, has compiled a *** dramatic list of 17 high-risk medications *** that you must flush down the toilet under specific conditions. Why? These substances pose unique dangers when mishandled. Here's the full list and why you can't afford to ignore it. 1. Fentanyl. 2. Fentanyl citrate. 3. Diazepam. 4. Buprenorphine. 5. Buprenorphine hydrochloride. 6. Morphine sulfate. 7. Methadone hydrochloride. 8. Hydromorphone hydrochloride. 9. Hydrocodone bitartrate. 10. Tapentadol. 11. Oxycodone hydrochloride. 12. Oxycodone. 13. Oxymorphone hydrochloride. 14. Sodium oxybate. 15. Tramadol. 16. Methylphenidate. 17. Meperidine hydrochloride. ***, but here's where medical wisdom collides with environmental debate ***. These opioid-based painkillers and stimulants aren't your average medications. They're classified as Schedule 1, 3 drugs, meaning they have high abuse potential. A single dose misused by someone, whether a child, pet, or anyone not prescribed them, could prove *** fatal ***. That's why CDSCO explicitly advises flushing these expired or unwanted drugs, to prevent diversion into the black market or accidental ingestion. And this is the part most people miss. *** flush doesn't mean discard carelessly. *** proper disposal is grounded in science. These drugs break down rapidly in water, reducing risks. However, experts like Dr. Devarati Majumdar of Max Healthcare caution that improper disposal of others, outside this list, accelerates antibiotic resistance and water contamination. Instead, unused medications should go into drug take-back programs, a topic often overlooked in public health discussions. *** The controversy. Some argue that flushing limited drug categories isn't a universal solution. After all, environmental agencies often warn against flushing any medications to protect water ecosystems. The CDSCO's stance acknowledges this complexity by restricting the recommendation to *** specifically approved high-risk drugs ***, balancing public safety and ecological concerns. Under India's 2016 biomedical waste management rules, states must implement controlled collection systems for obsolete medications. But until those programs reach every household, the CDSCO's guidance fills a critical gap. So here's the dilemma ***, should more drugs be added to this flushable list? Should alternative disposal methods take precedence? What would you do if you found a stash of expired opioids, flush them immediately, or risk leaving them in reach of vulnerable individuals? Share your thoughts. Do you believe the CDSCO's strategy aligns with public health priorities, or does it risk unintended environmental consequences?